So coming to the next topic, the nerve, important nerve is fifth nerve. This one is fifth nerve called as trigeminal. Trigeminal. Three, tri is three. It has got three gemini, three branches called as V1, V2, V3. So the three are, just try to remember, from eyes, ophthalmic, to maxilla, upper, and mandible. If you see the face, eyes, maxilla, mandibular. The names are ophthalmic, maxillary, mandibular. Three nerves from face, except the angle of mandible. This is left. The question is coming. This is angle of mandible. This is not supplied by trigeminal nerve. It is by the greater auricular, cervical. You know the cervical vertebrae are there. So greater auricle is supplying this, and this much face anterior part is supplied by trigeminal from here to like this, and posteriorly from the cervical nerves. Again, the greater auricular and all these nerves are supplying to posterior part of the scalp. So if you see, the trigeminal has got this trigeminal ganglion, three divisions: ophthalmic, maxillary, mandibular. Three divisions. These are passing through different foramen. Just as soon as it starts out of the, and then I will just go and show this. As we have seen, fifth nerve, two nerves from the forebrain, two nerves from the midbrain, four nerves from the pons, and four from the medulla. Midbrain, pons, medulla. So 2, 2, 4. So this is coming in the fourth, midbrain, pons, medulla. So it has to start from the medulla, and this trigeminal ganglion, pons, it should start from the pons. So only if you see, three trigeminal ganglion is a bigger ganglion. It has got three divisions. Ophthalmic is small sensory division. If you just go and see, when starts, it is ophthalmic. The name itself is ophthalmic, so it has to go near the eyes. Along with this, immediately as soon as it starts, it passes through the, if you see the skull foramina, this is the skull foramina. You have to correlate first olfactory, second optic. Olfactory is from the cribriform plate, second is optic, from passing from the optic canal, third, fourth, fifth. So there is superior orbital fissure. This is first, second, this one is first, two from the forebrain, the next two, third and fourth nerve. These are passing from the superior orbital fissure. So this is again important thing, foramina of the base of the skull. You have to study this along with the cranial nerves, as the cranial nerves are starting in from the brain and they are trying to pass out of this foramina to supply to their respective organs. So arrangement of this foramina is according to the nerves, and along with these nerves most of the vessels are passing. So if you see, this is cribriform plate 1, 2, then superior orbital fissure. From that, nerves which are passing out of this superior orbital fissure is third, fourth, fifth is the ophthalmic division, which I was telling like there. Somewhere here he has to be trigeminal ganglion. So if you see V1, V2, V3, so trigeminal ganglion, out of which three divisions are coming out. V1 is superior orbital fissure, V2 from rotamax, rotundum, max is maxillary, foramen rotundum, max is maxillary, and third division is foramen oval. So trigeminal ganglion, wherever it is sitting, it has got three divisions, and these three foramina are arranged in the sequence: superior orbital fissure, foramen rotundum, and foramen oval. So ophthalmic, maxillary, mandibular. So instead of confusing which nerve is passing which division, so rotundum is situating in the center, that's why second, maxillary division, so remember it to the rotamax, then oval, mandibular, MALE oval mandibular, then superior orbital fissure, anterior it has to go. So this was regarding trigeminal ganglion and its three divisions passing through the three different foramina. So here again you can see ophthalmic division, maxillary division, mandibular division. If you just go and enlarge, here is the superior orbital fissure. You can see this diagram is for the superior orbital fissure, and this one is maxillary passing from foramen rotundum, and this one is mandibular passing from the foramen ovale. So three divisions like this. So if you go and see here, you can see trigeminal ganglion, ophthalmic division passing through superior orbital fissure, and now dividing on the medial side, lateral side. This is on the lateral side. There is lacrimal gland. It is a lacrimal nerve. Above, the nerves are supratrochlear, supraorbital. Medial side, if you go anterior ethmoidal towards the nose, infratrochlear here. Then long ciliary. These are the ciliary ganglion. It is going to the ciliary ganglion and supplying to ciliary. So if you see course, when they are coming out of this, another important part which you need to remember while reading the nerves is the cavernous sinus. Here they are starting from immediately below that there is cavernous sinus. So you can see this is the cavernous sinus. Location of the cavernous sinus. Out of brain, when it comes out of it, it has to traverse through the cavernous sinus and come out of the. This is this picture I was showing. So here you can see superior orbital fissure is below this, and this is the foramen magnum. Here somewhere is the brain. So when it is somewhere here trigeminal, this is foramen rotundum and all that. So it has to pass through the like this. So the branches will passing from this, it has to first traverse through the cavernous sinus, then it goes out from the brain, whereas respect to foramina, and then supplies to the typical organ. So course is third, fourth, sixth. So these are the third, fourth, sixth is in the lateral wall of the cavernous sinus. So courses with means this trigeminal V1 ophthalmic division is passing along with this. So oculomotor, trochlear, and sixth is abducent. So the mnemonic for this is otom cat. A is abducent. C is carotid artery. O is oculomotor, trochlear. Third and fourth. Sixth is inside. Ophthalmic division. O is again ophthalmic division. So supplies the upper face including cornea and tip of the nose. So this is sensory supply to cornea. Okay, and tip of the upper nose. You can see this one. This one area is supplied by ophthalmic nerve. Supratrochlear area, tip of the nose, cornea, lacrimation, all this means lacrimal gland. Lacrimation is actually not done by this, it is sensory supply too. Then frontal, you can see branches in the lacrimal branch, frontal branch, nasoscale branch. So nose, ethmoidal cavity. Whenever a person gets sinusitis, headache, it is in the frontal area. Nose, eyes, any irritation in the eyes, a headache, most of the people get in this frontal area, this much. So that is the because of irritation of these nerve endings, ophthalmic division of trigeminal nerve. So any infection, any sinusitis inside the nose, any conjunctivitis, cornea, stimulation of the cornea, or any supraorbital, so this much part up to the head, this much part is a person is getting a headache. So that was about trigeminal nerve, the important part, ophthalmic division. The second is maxillary division. The questions is from which foramen is coming out. For remembering, just try to remember rotamax, foramen rotundum. Then it goes to pterygopalatine fossa and foramen infraorbital. Supply to maxillary is supplying. Basically, is name itself is giving maxilla means it is supplying, and it is also sensory. Don't try to confuse. Only mandibular division has got part mixed, so it is carrying sensation from the cheek. So trauma, head injury, numbness on the cheek due to injury to maxilla or infraorbital nerve, continuation of maxillary, infraorbital, supraorbital or ophthalmic, infraorbital. Infraorbital nerve flattening of the face due to fracture zygoma. So maxillary, any injury to the zygomatic bone, a person gets flat face and loss of sensation. That is infraorbital nerve, which is a division of maxillary nerve. Supraorbital, supraorbital is a division of ophthalmic. So again, you can see this. It is passing out from the maxillary, this foramen rotundum, and infraorbital nerve, superior alveolar nerve, and this is zygomatic, and supraorbital is from the ophthalmic division. This is these green colored, you can see these are sensory nerves, and brown are motor nerves. So coming to next branch, that is mandibular. It this out of trigeminal ganglion, it is coming out through the foramen ovale. This again a question. Mandibular is passing out of foramen ovale. Now this is important division which has got motor as well as sensory. So it is the largest branch. It's traveling to lot. Course is long, and main trunk supplies to now motor and sensory. If you see the brown color is motor and green color is sensory. This is anterior division, this is posterior division. Anterior division, when as soon as it comes out, it supplies to some of the muscular branches of medial pterygoid. This is V2. Brown color you can see medial pterygoid, tensor palatii means it is passing supplying to tensor palatii and tensor tympani. These are the membranes, tympanic membrane. So for tensing this membrane, this nerve is supplying to and palate as well as tympanic membrane. Then the medial pterygoid. Initially medial pterygoid supplied by this nerve. Then the next thing is it is supplying to dividing into two divisions, anterior and posterior division. And if you see, anterior division has got muscle supplying to the muscles temporalis, lateral pterygoid, and masseter. So these are the four muscles of mastication: lateral pterygoid, medial pterygoid, masseter, and temporalis. So medial pterygoid is supplied initially by this, and rest of the three muscles are supplied by from the anterior division. And along with it, the sensory nerve to the buccal mucosa is then posterior division. There again it has got two separate this is sensory nerves. One is lingual nerve supplying to the anterior two-third of the tongue, and while supplying to anterior two-third, it is purely sensory supply, not the taste sensation. The sublingual gland and submandibular gland. Now posterior division, another division is there, that is inferior alveolar. It is passing from the mandible bone, and there is one mental foramina out of which there is mental nerve and supplying to the inferior branches. Now if you see, these green colored are the sensory. One division is going posteriorly called as auriculotemporal nerve, supplying to the sensations from the near the ear. Then motor division is inferior alveolar nerve to mylohyoid muscle. So you can see muscles of mastication, then some of the muscles inside the ear, some of the muscles inside the throat, tensor tympani, tensor palatine, and muscles of the tongue, some of the nerve to mylohyoid. So it has got a long supply. You get anterior division, lateral, this told on the figure. So motor supply is important for muscles of mastication. So chewing is the basic, ear and tongue. These are again the, it is supplying to the muscles of mastication, maxillary, temporalis, lateral pterygoid, four muscles from the other four muscles are mylohyoid, and the tongue muscles anterior belly of digastric, tensor palatii, tensor tympani. So mylohyoid, anterior belly of digastric, tensor palatii, tensor tympani. Palate is in the pharynx, tympani is in the ear. It is supplying to tongue also. That's why ear and tongue and chewing. How to remember this? The basic chewing, and this is motor along, and sensory is auriculotemporal. The important is it is to the pinna. So whenever a person is chewing, eating food, some of the sensations they are related to auriculotemporal. Auricular gives supply to auricle, external ear, outer eardrum. So some hot drink or very spicy foods, when you try to chew and you get a sensation, sometimes a person feels something in the ear also. So these are referred pain. Temporal of the skin, temporal in the front of the ear, help glossopharyngeal to supply parasympathetic parotid. So supply temporomandibular joint. This is one of the question. TM joint, auriculotemporal, is supplying to temporomandibular, auriculotemporal, ear and temporal, temporomandibular, supply to joint. This is sensory. Lingual nerve is supplying below the medial to submandibular duct. This is submandibular duct. It is important duct. This duct is crossing to be from the lingual nerve. So any surgery on this may damage to lingual nerve. So general sensation to 1/2 of the tongue can be injured during removal of third molar teeth. Lingual nerve can be injured removing of the third molar teeth. This is another inferior sensory nerve, passes in the mandibular foramina. Then this is mandibular foramina inside the mandible, exit from the mental foramina. It is going inside and it is coming out. Then branches molar and premolar incisor tooth. So this is about temporomandibular joint. It is again, question is that it has got not a typical synovial joint, as there is hinge type of movement. Along with this there is gliding movement, hinge as well as gliding, anterior and posterior protrusion and retraction, that causes gliding movement. So it is covered by fibrocartilage and not an hyaline type of cartilage. So which muscles are acting on these? Muscles of mastication. For the muscles of mastication, masseter, temporalis, medial and lateral pterygoid. Just if you try to remember this picture, temporalis muscle, this is from the temporal. When you keep your hand and on the side of the head above the ear, you feel and start chewing, you get a, you can palpate that is temporalis muscle. And if you keep your hand fingers on the cheek and start chewing, that is muscle called as masseter. So this, if you see the picture, temporalis is from above and it is going inside the zygoma bone and it is attached. So temporalis is origin from the temporal fossa, coronoid process of mandible. So it is from above down. So whenever it is acting, it will lift the mandible. Elevation of the mandible is the action of temporalis. Second, if you see the masseter, it is attached. Temporalis, this masseter is from the zygomatic arch. This is zygomatic arch. Origin is from the zygomatic arch. This is zygomatic arch. Zygoma bone, fracture of zygoma causes flattening of the face. So on the cheek, when you are palpating, the most prominent portion on the cheek in front of this is eye, this is ear, this is the most prominent portion is zygomatic bone. So this is the arch of zygoma. From the lower part, masseter is arising. You can easily palpate, and this is attached to the mandible like this. So masseter is starting from zygomatic arch and lateral surface of ramus of mandible. This is ramus of mandible. This is the lateral surface. It is attached. So when this will contract, it will again cause elevation. Elevation, same. It is above downward. It is also elevating. This is elevation of the mandible. And when it contracts, it little bit retracts. Backward movement of the lower jaw. Mandible is the lower jaw. So it has to be retracted. Whenever chewing movement is there, it is just not closing and opening. This is just not like this. It has to move somewhere like this. Protraction, retraction. Lower part is protracting and retracting. Upper is fixed to the all these. So lower part is moving. So that's all the actions: protraction, retraction, side to side movement. It has to be of mandible only. You can see animals, they are having lot of side to side movement. So that is called as side movement. So upper movement is by temporalis, again upper movement is by masseter, and retraction is by masseter. And this is contracting, there is little bit retraction also. Now the what movement is left? Elevation is already done by so many, because elevation is important, that is chewing. Depression is not that much important, automatically it can help happen, but some muscles are there. So it is the movement of mandible. This is depression, this is elevation. So whenever a person is biting, so three muscles are acting to elevate, to chew. One is masseter, second is temporalis, and third is medial pterygoid. So first try to understand where is the attachment of the medial pterygoid. Origin, it is medial surface of lateral pterygoid process. So if you go little bit deep inside masseter and all this, there is a pterygoid process. From this medial surface of lateral pterygoid process, it is arising, and in medial surface and inserting on the angle of mandible. This is angle of mandible and the medial side. So elevation and side to side movement is by medial pterygoid, and lateral pterygoid is arising from infratemporal fossa plus lateral surface of lateral pterygoid process, and it is inserting on the temporomandibular joint and neck of mandible. So if this muscle is acting, that will cause protrusion and side to side. This is important: lateral pterygoid process, protrusion and side to side movement of mandible.